I'm really delighted to be here today. I just wanted to ask Darla for just a moment, what could be sexier than assessment? I mean, you set a very low bar for today's conversation, and I really appreciate it. This is just what I've devoted my life to, but that's okay. I feel good about it. As you know, we gave you a homework assignment. Darla asked me to put together some slides and some information that I hope many of you have looked at over the past few weeks, few months. And as a good person in assessment, I thought what I would do today is start out with a test. Okay? So we talked about 4 topics. Look, you're all getting nervous. I really like it. Look at everybody got quiet. They started to look down at their papers. That's a beautiful thing. So we talked. I talked about what are the 2 types of tests or assessments. How does assessment affect learners? Who cares about assessment? And what are the characteristics of good assessment? So there are the 4 things I talked about in the slides. So what we will do is, as a group, go through these. So my first question to you, now that I know you've all, those of you who are not looking down now, have reviewed this, what are the 2 types of assessments that were identified in the work? And what do you think of them? Formative and summative. This is a really good group. Ooh. You want to tell me a little bit about formative assessment? Does somebody want to talk to me about that? You know the names. You got to go further.
Be sure to use your mic, Maddie. Can you turn on your mic? Thanks.
Formative assessment focuses on student learning. So have the activities that the students have engaged in help them to learn.
Beautiful. Perfect. And summative assessment is? Now, there will be grades given out if you keep this up. Summative assessment? Anybody? Thanks, Carol.
Summative assessment is to measure achievement and essentially tell other people where the learner is.
Right. Absolutely. So they're the 2 forms of assessment. Great job. Class did an excellent job. And they're really critical because once you decide on a purpose for some test or assessment, it drives everything else. So the first thing you need to decide about when you do an assessment is what the point is, because you're going to pick completely different items, completely different sorts of interactions, depending on what it is you want the test to be about. And you got the definitions, you nailed them. The one thing I did want to point out is that if you look internationally, the words formative and summative are used differently in different countries. So there's a whole host of language that different people use in different places. And if you go to, for example, to the UK, you can talk right by people in terms of the use of the English language. 2 people divided by the same language, as the quote goes. So if it would be okay by you for today, it would be nice if we used these 2 terms, formative and summative, just so that we're communicating with each other. Okay? So how does assessment affect learners? I'll give you a little clue. There are 4 answers. Okay. Yes, thanks.
In the formative case, it enhances learning.
Absolutely. So it shows where there are flaws in what they're doing. What else? Good. Yeah.
In the summative, it indicates that there's safety and competency.
Right. So one way is to ensure that learning has occurred. Absolutely. Yeah, Trinita.
What they will learn.
Yes, so it guides their learning. Absolutely. Yes, thank you.
And it provides a basis for benchmarks for progress.
Benchmarks for progress. Absolutely. Yes.
Assessment can also provide for the educator gaps in the curriculum, gaps in the program.
Absolutely, absolutely. Feedback to the teachers and the institution. Anything else? Oh, this is pretty good. So it motivates students to learn. If you knew that there was going to be a test this morning, you would have watched those slides, I bet. Right? It directs the students' learning by signaling what's important. There's a wonderful example in medicine. If students are given a multiple choice exam, they go to the library to study. If you give them a simulation with patients in it, they go to the bedside to learn. So what you choose to do in terms of assessment directs learning because it signals to students what's important. As we talked about, and this is the most common use, is that it ensures that learning has occurred, and clearly everybody needs that in both the healthcare system, patients, people who use the healthcare process. Summative assessment is the most common type of assessment. And the last is actually a relatively new one, which is create learning. There's a wonderful series of studies by two guys, Karpecki and Roediger, and they did a whole series, and there were other authors in there. I haven't cited them all. Basically, what they did is they had a passage, read a passage, science passage, and they gave the science passage to a group of students to read. And then they divided the group in half. In one group, they got to read the passage 3 more times. The other group got to take 3 tests. They didn't get the answers to the test. They didn't get the scores on the test. They just took the test 3 times. And when they assessed them again 2 or 3 weeks later, lo and behold, it's the kids who took the test 3 times that did better than the kids who read 3 times. And they've replicated this as publication in Science in 2011 that's more sophisticated than what I just described. And the bottom line is that in order to learn, you need to be able to retrieve information as well as just taking it in. So the hypothesis is that assessment creates learning because it allows you, it forces you to retrieve the information that you have and use it. Yeah?
So you use the term catalyzing learning.
Mm-hmm.
Is that above and beyond what we would do through signaling and others? What do you mean by that term?
Yeah, it is above and beyond that. It's one thing to tell a student what is important to learn. It's another to provide them the kind of feedback based on the assessment that drives their learning. So it's a much more specific version of just signaling what's important. It's a using an assessment in a way to create learning among the students. So yeah, that's a really good question. Yeah, please, yeah.
Isn't there a danger of using assessment for learning that the students would study for the assessment rather than open themselves up to critical thinking and not be focused on the specific things that are going to be happening in the assessment?
Yeah, and it really, is, given your concern, it's really important that you choose the kind of assessment you do very carefully. You can find assessments that help students think critically. You can create them, and you can reward them in the assessment process. So you're absolutely right. Historically, what we do is we put together a series of multiple choice questions, and everybody studies goes to the library, reads details, memorizes facts, and then at the end of the day regurgitates them and forgets them 5 minutes later. So it's really, really important that you choose the kind of assessment properly that encourages students to do more than that. When standardized patients became a big event 20, 25 years ago, that was precisely the reason to begin to move beyond the simple recall of knowledge. That said, there's still a place for that, for knowledge. There's always a place for knowledge. But if you stop there, then you send all the wrong messages. Good. Other questions? All right. Who cares about assessment? Who doesn't? I didn't have that. I didn't have all of the above in my answer, but that'd be really good. So students, obviously, right? Yep. Teachers, patients. Patients are quite interested in it, but from a slightly different perspective than the students and the teachers, perhaps. Regulatory bodies care. So just about everybody cares, you're right. So you're doing really well. This is a good group. Last question. What are the characteristics of good assessment? This is the hard one. So give me, there are 7 of them I have up here, but. Validity and reliability. Oh, you got 2 points. That's good. Yeah. Equivalence. Excellent. Very good. Timely, yes. Feasibility, absolutely. This was the hard one. Yeah. Acceptability. Very good. You're really good. You should come up here and do this. So there are 7 in total. The first and probably most important is validity. That sort of, does the test measure what it's supposed to measure? If it doesn't, then the test is really pretty useless. I mean, this is the most important thing. If it doesn't measure what it's supposed to measure, then it's a non-starter. You might as well throw the test out the window. No test will be perfectly valid. I mean, it's impossible that it's spot on. Most tests will be somewhat valid, and the idea is that when you put together a test, you develop some evidence that speaks to its validity. So that's the first and probably the most important. Second characteristic of a test is reliability, and that's a little bit more technical. If you took the same students and gave them the same test 2 weeks later, you'd want them to get the same score. And that's what reliability is about. So it's possible that you could have a test that is very valid, but not very reliable. Likewise, it's possible to have a test that's very reliable, but not very valid. And in fact, that would be a bad test, because validity is the most important thing. That said, if a test is valid but unreliable, it's not going to be particularly useful. Third is equivalence. Excellent. When you give a test over time, any form of test, whether it's collecting ratings from patients or ratings from faculty members or whatever you're doing, it would be nice if whatever results you had the same meaning over time. So let's think about multiple choice questions for a minute. If I have a set of multiple choice questions, I can give them to everybody in the room, and I can compare everybody's scores, and I can know that Dr. Cohen got the highest score in the room. Okay, and it's a direct comparison. Everybody's scores are equivalent. Everybody's on the same level playing field. So that's an important characteristic of a test if that's the purpose of the test. At the same time, that excludes lots of assessments that I think are incredibly important, like watching students with patients, because patients are different, and so the playing field is never completely level. So it would be nice if all tests were equivalent. This is an important characteristic of the test, depending on its purpose. But I wouldn't think it's important enough to exclude watching students with patients and a variety of other forms of assessment where you can't see students doing exactly the same thing. Okay? What? Go ahead. Go.
There is a context. There is a meaning to the question for the students. So there is something that's missing there, and providing the rationale for the particular response is also. These are the easy things to do, but the harder one is to really provide the opportunity for the thinking behind why the choice of this particular answer. So I don't know how we get to that.
Well, I'll take a guess. Could you put together an essay question that did that? That asked students to think critically about a topic and write critically about it? Oh yeah, no, we'll agree with these things. Oh, I could easily make, not just me, I mean people who really know how to do this, could really make an essay test that is both valid, reliable, and equivalent. And it is possible to do. It has been done. And it really is not that hard. There are 2 or 3 principles around that you need to attend to, but I really could do that. Okay? I promise. You don't believe me. Ask Dr. Cohen. He's worked with me for a lot of years. He did tell her, Jordy. He's Or we'll have to talk offline. I want to work on your test. The four other characteristics are educational effect, and I already sort of mentioned this. If you give students multiple choice questions, they go to the library. You give them standardized patients, they go to the bedside. Catalytic effect we talked about, and that is that the feedback from the assessment provides an opportunity, catalyzes learning, creates learning. Feasibility, which someone mentioned, obviously if it's not feasible, you can't do it. And acceptability, it actually is reasonably important that people, when they look at a test, say, yeah, this really sort of measures what I thought it was going to measure, because it buys in faculty, it buys in students, and it gives the entire process credibility. Okay? All right.